Good morning, everyone, and welcome to the National County Government Month for Durham County Government. We are really excited about today and welcome everyone to this event. We are very excited. This is our first event for National County Government Month for Durham County. Every year, Durham County Government participates in National County Government Month as a way to bring awareness to what counties do. Today, we are hosting a virtual session where we will highlight the Durham County Resident Satisfaction Survey and the Community Health Survey. So I'm going to go ahead, you all, and start sharing our slide. Please note that today's meeting is being recorded. I just want to make sure everyone is aware of that. And if you have any questions, feel free to use the chat to communicate and or present any of your questions. So give me one moment here. Again, welcome to today's Durham County National County Government Month lunchtime and learn series. We are hosting today a DECO Resident Satisfaction Survey and DECO Community Health Survey discussion. We're really excited to have with us today Savannah Carrico. She's an epidemiologist with the Durham County Public Health Department, and Josh Edwards, Director of the Durham County Strategy and Performance Department. I know that you all received the description of today's event, but want to make sure we just cover it again. Durham County's annual resident satisfaction survey is a crucial instrument for evaluating public opinion on county services, guiding strategic planning, and fostering community engagement. The 2024 survey, conducted in collaboration with the City of Durham and Durham Public Schools, gathered insights from residents reflecting the diverse perspectives within our community. The 2023 Durham County Community Health Assessment provides an in-depth analysis of the county's health status, highlighting areas such as housing, education, and access to health care. Both surveys underscore the community's strengths and challenges, offering valuable insights for local government employees to enhance service delivery and promote well-being of Durham County residents. Director, as I already said, Director of Strategy and Performance, Josh Edwards, and Public Health Epidemiologist, Savannah Carrico, will explain the information gathered through these two instruments used to improve services offered by Durham County government to our community. Now, Savannah will take over the presentation, but before she does that, I want to make sure we go over some quick things. The session, like I said earlier, is being recorded. We ask that you keep all your microphones on mute unless we open up the opportunity for conversation. Post any of your questions for the speaker about the presentation in the chat. Savannah, thank you for joining us today. You can take over from here.
Thank you so much. I'm excited to be here. Good afternoon, everyone. Let me pull up my slides here. All right, and you're still seeing my full slides there?
Yes.
Awesome. Okay. Well, good afternoon, everyone. My name is Savannah Carrico. I'm the public health epidemiologist here at Durham County in the Public Health Department. I've been in this position for almost 4 years, actually, and I'm here to talk to you today about the Durham County Community Health Assessment and why it's so important and why we do it the way we do it. Here we go. So what is the Community Health Assessment? Well, many of you are probably already familiar with it since it's such a crucial part of the public health infrastructure and how we make decisions. But just to give you a brief overview, the Community Health Assessment is something that we do in partnership with Duke Health and Durham. So we partner with both of these organizations to really go out in the community and meet Durham residents where they're at. And we try to improve the survey every year. So for the last couple of years, it's changed slightly. So we last did this in 2022, and we pretty much threw everything out the window and redid it all. So that's kind of where we're at right now. We are in the middle of conducting surveys right now until the end of June 30th. So the survey collection part is kind of the most crucial step when building the community health assessment because it gives us a snapshot of the health and well-being of Durham residents at that time. And that data then is later used to identify the key health priorities, and then it goes into developing the community health improvement plan and releasing the state of the county health report. And I'll go into more depth about that in a minute. But here's the cover of the 2023 community health assessment. This is the most recent one we have. The next one will be drafted and written in 2026 and will be published early 2027. So we are 2 years away from that goal, but we got to start as early as we can because it really does take 3 years. So I want to brag here a little bit about Durham County and why we lead the way. So Durham County has been told that we are the gold standard for the North Carolina County Community Health Assessments. So we're very proud of that. I also wanted to point out that in 2017, 2020, and 2023, Durham County Community Health Assessments won the Award of Excellence for North Carolina. And we hope to continue that tradition for the 2026 Community Health Assessment. And another point to brag is in 2024, this past September, Durham County was anointed at the 2024 NCPHA Fall Educational Conference as the best health department in North Carolina. So just a humble brag there, but I wanted to point out that this could not be accomplished without all of our partners and the DECO staff that we have that have been so dedicated and have volunteered their time to help with such a big project. And we just couldn't do it without the Durham community. So here is the process, a very simplified process that takes about 3 years to complete. So we began looking at the 2026 Community Health Assessment project as a whole in the middle of 2024, actually. So we took about a 2-month break, I want to say, between the previous trial cycle and the new one. So we were very, very busy the whole entire 3 years. So we started designing the surveys that we're going to use this year. We then decided on a sampling method, which is crucial because it decides how you want to get a representative sample of Durham County. In the past, many of you know that we have gone door to door, and we just decided that though that was best practice when it came out in 2010, it's just not really that reasonable or feasible or as efficient as other methods are in this current climate. And so we have decided to do a convenient sample this time where we're not going door to door, but we are partnering with local organizations and going to different locations like the libraries and the farmers markets to collect surveys for the community health assessment. And that is going fantastic. I will share a little more about that in the next slide. So the survey collection part is collecting the primary data. Once that's done at the end of June, we will analyze and interpret the data that summer. We'll conduct listening sessions throughout the community based on the findings of the community health assessment. We'll then take that information and directly apply it to determining the next 5 health priorities. That will all be written up and dissected and presented in the community health assessment report that will be submitted to the state early 2027 and be available for publication shortly after. From that, the community health improvement plan is put in place, which takes the 5 health priorities we decided and breaks it down into accomplishable steps that we can do over the next 3 years. And then, of course, we implement all of these resources and all of this hard work, and we evaluate it and see what can we do better for next time. So just to point out, we had some fun along the way. So you can see here the trademark blue shirts worn by our volunteers and contractors with survey team on the front. They are some amazing people. Yeah, these are some incredible people that we got to partner with. On the top left there is a listening session that was a meeting for the community health improvement plan, excuse me, to go over how to address the top 5 health priorities. In the bottom left, this is a listening session that we attended. It was fantastic. I always walked away from these listening sessions
Hi, everyone. Just want to let you know we're having a slight technical difficulty here that we're trying to resolve. You all will just be patient with us when we get back on. We will make sure we begin the slideshow right away. I'm going to make contact with Savannah just to see what might be happening on her end. Okay, unfortunately, I'm unable to reach Savannah at this time. We'll give her a couple more moments. Just want to share with you all that tomorrow we have another Lunch and Learn series that we're excited about as well. And there'll be a presentation from our youth home. They'll present on their program Rise. And so we'll share more information about that. At the end of today's program, we have a survey link we would love for you to fill out as well. And like I said, we'll give Santa maybe one more minute. And Josh, if you're prepared, maybe we can go ahead and move on to your presentation and just so that we can keep things going. And when Savannah logs back in, then maybe we can go back to hers. What do you think? Are you ready, Josh?
Yeah, I'm ready if you want me to go and go.
Okay. Director of Strategy and Performance, Josh Edwards, thank you for joining us and presenting on your portion of today's Lunchtime and Learn series, focusing on the Durham County of the Durham Resident Satisfaction Survey. Please take over now.
Everybody see my slides? You can just do a thumbs up in the chat. All right, wonderful. All right, at any time, if you lose my audio or can't see my slides or whatnot, just let me know. So again, thank you for the time today. I'm here to present on the resident satisfaction survey. Going to talk a lot about the 2024 survey results and also the history of the survey itself. So again, I'm Josh Edwards, Director of Strategy and Performance for Durham County. We have the Durham County Strategic Plan, which is DECO Forward 2029. The survey itself is executed and has been executed by the ETC Institute, which is a surveying corporation for this for the past history for Durham County. So some background. So again, the resident satisfaction survey, this past one for 2024 was the 10th consecutive annual survey that Durham County has done. The survey is a partnership with the City of Durham and their Office of Innovation and Performance. Previously, the survey had been executed by the Public Information Office. So I believe Director Deborah Craig Ray is on, and Dawn and her whole team had been the one that executed the survey in the past. So thank you very much for all your hard work. The Office of Strategy and Performance picks it up this year. And it's become part of our portfolio. So real quick too, if you haven't ever seen the survey or haven't received it as an individual in Durham, it's pretty long. It's 37 plus questions. And as part of the outreach from ETC, they do incentivize the survey with a gift card giveaway. Just so you can see some of what you may have received if you ever get the survey in the mail. It looks very similar to this. So you'll have both city county logo, um, a Likert scale of surveying questions. So from very satisfied to very dissatisfied, or NA. There are some open-ended questions, like one for this past survey was public safety, if you feel safe or unsafe in situations. Um, so uh, just some examples of how the survey instrument itself looks. So why do we do this resident satisfaction survey? Well, the big reasons are to objectively assess the resident satisfaction with the delivery of major county and city services. Of course, we're focused on county services. Also to help determine the priorities of the community and to measure trends from previous surveys to the current survey results. And one thing that is offered by the ETC Institute is a comparison of the county's performance on the survey with other similar communities. So methodology. So the survey itself is a 7-page survey. It includes many of the same questions year to year that gives us an ability to look at trends over time. They administer the survey by mail and online to a random selection of county residents, both those who own property and who rent in Durham County. The requirement based on our contract with ETC is to collect 800 results. In 2024, we collected 810 completed surveys. So the big thing here too is that margin of error is plus or minus 3.4% at a 95% confidence level. Now, what does that mean? Most people are going to ask. So a confidence level basically means this. If we were to take this survey and repeat it 100 times, 95% of those times that we repeated the survey, the results would fall in between the two far left and far right dotted lines. So at 95% confidence with a margin of error of 3.4% either way on the results. And then you'd have the other 5% that would fall below or above that bell curve. Just if you have a question on that later, I'd be more than happy to go over it some more. So in the 2024 survey, we had a good representation throughout the county. Every red dot you see here on this particular map is a respondent that responded to the survey. Demographics of the survey respondents reflected the actual population of the county, and we'll go into that in more detail in a second. If you're interested in seeing it by census tract, we also broke it down by census tract as well, so you can see the responses there. So like I was saying for the demographic breakdown, if you look at the most current census data for Durham County that I could find, it breaks us out to but roughly 43% white, 34% black, 15.4% Hispanic, and 7.2% other. The satisfaction survey broke out similar to this. Unfortunately, the way the results are put into the system, it doesn't differentiate between white and Hispanic and Latino, and so it comes into one graph. But I can tell you that out of this 52%, roughly 5 or 6% was Hispanic and Latino. As far as the age of respondents, the median age in Durham County is 35.8 years. Ours broke out into that range. That 35.8 was the highest response rate at 35 to 44. But overall, survey respondents, span the range between 18 and 74 plus years old. So it's a nice breakdown of respondents. Another big one too is the breakdown of gender, female to male. And as you can see in our graphs here from the satisfaction survey, we had roughly the breakdown of Durham County's percentages: 51% female and 47% male, and then 1% non-binary and 1% not provided. All right. So what did we learn from the survey? So residents have a positive perception of Durham County. 76% of respondents rated Durham as an excellent or good place to live, which was fantastic. We've always rated quite highly on that. The Durham County rates 33% above average in customer service of county employees, which again, we have amazing people in the county. Top community priorities that were listed out in the survey were public schools, affordable housing, of course, police protection is a city function, and so is street maintenance. And then top county only priorities were public schools, sheriff protection, and then the Department of Social Services. So again, topic one, residents have a positive perception of Durham County. So as you can see from this particular question, which is this question 3, this level of satisfaction with items that influence perceptions of Durham, the quality of life in Durham, quality of services, etc. The big one we want to focus on is this quality of services provided by the county. From this, the combined very satisfied and satisfied was 46% of respondents. So that's how we got that really high level of confidence in our services being provided. Another one was the overall rating of the community with regard to the county. So out of these, again, there's a lot of results here, a lot of questions that are asked. The top ones that we kind of focus on is how they see the community as a place to live, as a place to work, and as a place to visit. Between these, again, you can see that positive perception of the county is high among these 3 responses. So the next one that I wanted to talk about was satisfaction with major categories of services provided by city and county. And again, there's a lot to see here in this particular slide on this response rate. So what I did is to help to kind of narrow down some of those responses and how they apply to Durham County is I broke it out into some of the higher ranking ones that are only county services. So one of the big ones is our quality of library services and programs is always rated very highly. Out of this one, they had either very satisfied or satisfied rating of 83%, that's huge. It's amazing. EMS services, response for EMS times, both highly rated as well. You can see some of the ones that again were top priorities for the county, like Durham County Department of Social Services. We can see our response rate there. It has a lot of responses in that area of being, in the middle. They didn't rate it very satisfied or very unsatisfied, just kind of a neutral response. And then, as always, the quality of public schools had a strong rating because there's a lot going on there now. So geographic analysis. So the other thing we want to make sure is in communities and neighborhoods in Durham County, we want to make sure that we want to see how residents feel about their community, about their neighborhood. This particular graph here shows a breakdown by zip code. And what it is, the darker the blue was excellent. They feel excellent about the quality of life in their neighborhoods. As you can see, far north, we had an excellent rating, and then far south to the left, also excellent. But for the most part, almost all the respondents had this feeling of being in a good neighborhood or in a good area for their quality of life. Topic number 3 was the comparison to other communities. So one of the things that's offered by ETC as part of their analysis of the results is a comparison to the Atlantic region, which is a grouping of southern states, Atlantic coast states. And they did a survey of 10,000 total respondents for getting these averages, or the national average. This particular graph here, which is major categories of services provided by the city and the county, we have Durham County at the top with the dark blue, the Atlantic region, which is the light green, and national average, which is the light blue. As you can see, for quality of library services, we rank well above any of our comparison sites here. We also rank high above quality of fire and life. Some of the ones that did drop below the comparison areas was response time for EMS services, as an example. And then again, going back to that level of customer service provided by Durham County, as you can see here, customer service received by county employees had a 62% positive rating, and comparison to our communities in this particular result was 36 and 39 nationally. So that's amazing. So doing great in that area. Some of the areas of services provided city and county that have dropped some is the quality of bicycle facilities as part of our transportation department. We have a reduced or lower positive rating there, is in the very satisfied and satisfied category than our comparative areas. Also, the quality of public transit systems, and then again, quality of public schools, all rating well below the areas of comparison. So again, all this is great feedback to learn how we're doing as a community and as county services. Last one that's on this particular area is the overall ratings of the community. Again, as a place to live, place to work, place to visit, very high increased areas of rating. One that was a little odd was that we had a reduction in as a place to raise children compared to our comparative areas. So trend analysis. So that's one of the big things we want to get out of the survey is looking at the trends over time of how we did based on previous years compared to the newest survey. So the notable increases for between the 2023 survey and 24 survey was as a place to retire, amount of littering in your neighborhood, quality of life in your neighborhood, and solid waste collection services. Decreases were how to manage, how schools manage education budget, schools being transparent, and then the accuracy of information given. So again, this is only comparison of 2 years, so 24 to 23. Now I'm going to come back to some of the trend analysis in just a second, just so everybody knows. I have a little more information there. The last thing is this particular question, which was question 2, which major categories of services do you think should receive most emphasis from city and county leaders over the next 2 years? As you can see from this, the quality of public schools was our highest one for the county. Next was the quality of pedestrian facilities, that's bus stops more or less, and the quality of public transit systems. So again, those areas that we saw reduced satisfied and very satisfied ratings, residents also said out of this grouping they want to see more emphasis there. And the other thing was a very important question we put out there was from the list of local government services below, prioritize the top 5 that you want to see increase in funding. Again, for us, public schools became a huge one, affordable housing, and then job creation and training, and universal pre-K. All major categories of services provided by Durham County. So I'm going to do a little shout out here for the Durham Open Data Portal. I'm not sure if anybody here is familiar with it, but we have a portal that exists between the city and county that houses a lot of data sets that we collect as both city and county services. They provide data stories. And one of the big things that's there is that we have a dashboard that has all results for the resident satisfaction survey going back to 2015. So I'm going to click into this and it's going to redirect us to that survey itself. So when you go on the site and you look at the actual survey results, you'll see this pop up. Just a quick run through, there's an overview of it here about what the survey is, about the dashboard itself and the report. There's a guide on how to actually interact with the dashboard here. I'm not going to click through it. Or you can jump to survey categories that interest you. So I'm going to jump around here for 1 second, or you can navigate down to the bottom here. One of the big ones that I really want to emphasize and look at is the third report on this dashboard goes into the satisfaction survey detail. So in here, you can look at individual questions over time. You can see how they've responded, how many people responded, the breakdown of gender, the breakdown of home ownership, of race, ethnicity, age, everything else. So it's a great little resource to really dig into the survey and to understand it more in depth. So if we want to look at the appropriateness of county employees' responses, we can click here. And now we can see how that's changed over time. So in 2016, when we first asked this question, we had a 60% positive rating. as of 24, we had a 57%. If we want to look at, let's say, as a place to raise children over time. So we started off at 61%, we hit a high of 63, and we have dropped to 54% over time. The bulk of respondents own a home. And again, a lot of useful information here that we want to have out there and open to everybody to review. Go back to my slides now. So next steps, again, as I stated earlier in the presentation, Office of Strategy and Performance just took over the survey this past year. We work closely with our sister organization, sister department in the city, who is run by Sherry Metcalf. And the current state of the RSS, based on their analysis, our analysis, and some independent review, was, again, the survey's too long. It's 37 questions. It takes a long time to do. Survey occurs too often. It's done annually. When you do it annually, by the time we get the survey responses back in February, March, it's hard for us to make changes before we have to execute the next survey and have it sent out. There needs to be more in-depth analysis of the survey over time. We need departments to partner with us more on questions that are being asked, wording of those questions, which ones are most appropriate. Other thing too that came up is questions are not exactly divided equally between city and county, and since we would partner on this, we think that should be a focus. Next steps for the Office of Strategy and Performance, we're suggesting that we go to a biannual survey cadence. So every other year we'll have a survey. We may work with the city closely to have a cadence of something like the counties on the odd years and the cities on even years. We're not sure yet. We're working through that. We're going to develop a new report in Power BI that will be used by county departments to analyze the results of the survey individually and be able to decide on decisions that are driven by those data points on how they respond in their work efforts to improve the scores. So just a few things that we're looking at doing in the future. That's the end of my presentation. If you have questions that came up or you want to ask a question, Dawn, I'm not sure if we have time for that or not, but be more than happy to answer anything.
Well, we do have one question, Josh. Thank you so much for that presentation. We have a question from Marissa Mortiboy. She says, how many people did you send the survey to in order to get 800 completed? Was it one survey per household?
It is one survey per household, yes. As far as the total number of respondents that received a request to take the survey, I'd have to go back and look at the data that came in from ETC. I think it was somewhere in the area of 1,000 or 1,200 they actually sent out, and they got 800 back. They do follow up. So if a person is sent a survey individually, they do follow up with them because they have a collection of emails and phone numbers that they can contact and ask that person if they were able to complete the survey, if they needed any help. Because we use a contracted service, they do push pretty hard to get those numbers of responses they needed. And we do require them to get, the contract requires them to get as many responses that mirror the demographics of Durham County, so that we have that breakdown in the survey results. Does that answer your question, Marissa?
Yes, thank you. I was curious how your response rate was so high.
Yeah, that's how.
Thank you, Josh, for your response to that question. Again, thank you for your presentation. And if there are any other questions, please feel free to drop them in the chat. We will have a short Q&A portion of today's series at the end of the next presentation. However, again, if you have questions in the meantime, feel free to drop them in the chat. Savannah, thank you so much for joining us again. And sorry about your technology issues, which we all understand. Savannah Kiriko, epidemiologist for the Durham County Government Health Department. She's going to start her presentation over again on the community health assessment and explain that to us. Savannah, are you ready?
I am ready. Thank you, everyone, for your patience. I didn't mean to, waste your time like that. I apologize. But I've only got about 5 minutes left, so I think we can get you out a little early. Let's see. So I was told I was on the photo page. Yeah, so just wanted to mention that this is a collage of photos from out collecting surveys from the listening sessions that we attended, as well as a meeting at a local business to discuss the health priorities and the community health improvement plan and the steps we want to take. All right, so coming up with these health priorities, we did it a little bit differently this year because we really wanted to incorporate the data that we collected from the 2022 surveys. So for 50% of the decision was going to come from the community health assessment data, 75% of which was going to come from countywide respondents because that data was able to be weighted and guarantee a representative sample of Durham County. And then the remaining 25% of that was from the Comunidad Latina, which is our survey, specific to the Hispanic and Latina population. The remaining 50% was divided equally between the listening sessions that we held, as well as census data and county health ranking data, just to get some community health data in there, as well as the Durham County primary data. And for the listening sessions, we were able to conduct 14, and 7 of which were conducted in Spanish with the help of El Centro Hispano. The top health priorities that we determined, number 1, again, affordable housing. We just saw this over and over in the community health assessment data, in the listening session data, and we just felt like it had to be number 1 again, and that's how the data turned out. Number 2 is access to healthcare and health insurance. Number 3 is actually a new priority that we titled community safety and well-being. That's because this type of issue, violent crime, theft, came up several times in the community health assessment data and listening session data. And we wanted to make sure it was included because that's what we were hearing directly from Durham County residents. And we want to make sure that we are listening to them and implementing what they need in their community. 4th, mental health, and 5th, physical activity, nutrition, and food access. So now what? So we got about a 2-month break, I want to say, between the previous CHA cycle and this CHA cycle. So we actually began this whole process in the kind of the end of 2024, and now we're in 2025, and now we're collecting surveys. So we really began designing these surveys back in July or August of last year. And we incorporated a lot of partners with it to make sure that we got the survey exactly how we wanted it and how we wanted to collect that information. We decided to do a convenience sample this time by going to local events and locations. And then we are currently at the collecting the primary data or the surveys. So we have been conducting these surveys since mid-March, and we will continue to do so until the very end of June. So what's new? So I mentioned that we pretty much tossed everything out the window and we came up with a whole new process for this cycle. So for the 2022 countywide, we collected 205 surveys. We went door to door, and we had an online option as well as a call center that was available for taking the surveys. It was completely volunteer based and it was time limited. Unfortunately, we couldn't be out as long as we wanted to just due to daylight saving times and the cold weather. And then last time we offered some swag like a lunchbox and tote bag, as well as some COVID-19 tests as incentives to people that participated in the survey. So this cycle for 2025 for the countywide survey, we, as of 2.5 weeks in, we had over 230 surveys. Now, just, honestly, a week later, we have over 300. So it's just been going extremely well. We have over 20% of the surveys that we want to have. So we're really excited about that. This is being conducted by some contractors that we hired, and as well as volunteers from the community and from Durham County government or City of Durham or Duke. We'll be going to the locations like the libraries or the farmers markets and events later on. We'll be conducting, like I mentioned, through June 30th. And this time we're offering some swag like a tote bag or lunchbox, as well as some Smart Pop and boxed water. And every person that takes the survey is eligible to enter a raffle to win a smartwatch or another prize. So we are drawing those every Monday, so weekly. And so this is just a great opportunity to incentivize Durham County residents to take the survey, and it's been going very well. So this year we're doing 3 surveys. So we have the countywide and the Comunidad Latina, as we normally do. We've been doing both of those surveys since 2013. And for all 3 surveys, you must be 18 or older and live in Durham County to be eligible to take it. Like I mentioned, the countywide will be conducted by DECO DPH staff, volunteers, and community members. The Comunidad Latina survey, you must identify as Hispanic or Latino, and we have partnered with El Centro Hispano to collect those surveys for us. And then this year we added a 3rd survey because we thought, why not? But actually, this survey has been extremely, it's been asked for a lot from our partners, and it's something that we at DECO DPH have wanted to do for quite some time. We have added a survey specific for the Black or African American community, and we are partnering with North Carolina Central University faculty and staff who will also be helping us administer those surveys. So we're very excited for this. We have the capacity for it, and it is the first time we're doing it, so we expect to hit some road bumps, and we'll be able to come back next cycle even stronger. But we are very excited to see the results of all 3 surveys. So then we just continue the cycle. So this summer, we'll be analyzing the data. We'll conduct some listening sessions in the remainder of the year, and then we'll determine the health priorities. And then the remaining year or so will be about creating and distributing the new community health assessment report. We'll create our new community health improvement plan, and then we'll implement and evaluate, and then eventually we'll start all over. And I just wanted to point out that this is a huge survey that is heavily invested in, and it's heavily used by elected officials, by Durham County, City of Durham employees, and for community members and local organizations. So you can see here the community health assessment is number 2 for the 2025-26 budget. It does take a lot to make this survey possible, but we truly couldn't go about it or do it without the volunteers and community members that have been so dedicated to Durham County and to letting us know about what's needed for the health and well-being of Durham County. So this data is being used, and it is extremely important to collect it. So we are actually out in the community now, so you can look for us in the Sapphire Blue Survey Team shirts. We'll be going to local libraries, events, and health fairs throughout the remainder of the spring. And if you're interested in learning some more or learning about the community health assessment or checking out the community health assessment, you can do so at healthydurham.org. And you can find it in the title page as well as the recent health data page. And if you want to sign up to give surveys or volunteer your time in any way, I've included a link here to volunteer for the, it's the volunteer interest form. So once I have your information, I'll be sending out an email to get you trained. So that's kind of what we're at. We're very excited with where everything is going. And that is what I have on the community health assessment for you today. So stay tuned.
Savannah, thank you so much for sharing that important information about the community health assessment survey with our audience today. If there are any questions, please feel free now to ask those questions for Savannah or Josh, or drop them in the chat, and we will be sure to relay those to them. If not, I just want to again say thank you to everyone for joining us for National County Government Month. Let me get my slides back up here. You'll be patient with me. Let's share my screen. Okay. All right. Just want to share with you all again that tomorrow, actually, we are hosting another Lunchtime and Learn event for National County Government Month. It will be on RISE Assessment Center, Empowering Durham's Future is the title of the presentation, which will be led by Jennifer McGrant from the Youth Home. We invite you to join us for that presentation, which will also be virtual and recorded and shared on our YouTube page. You can see here that we have several events planned out this month during National County Government Month. We are really excited every year to celebrate this opportunity with over 3,000 counties across North America. And our goal is to raise awareness of what counties do. And so we have a myriad of different presentations and activities for you to get involved with. And we hope that you will sign up for more throughout this time period. We'll be here from April 1st to April 30th. Thank you again for joining us. And if you have the opportunity, please do complete a survey for today's presentation. You can scan the QR code, or we'll drop the actual link to the code in the chat, and you can feel free to complete it at any time. Again, if you have any questions, this chat will continue for, as long as we keep it open. And you can drop your questions there. We'll be sure to share them with Savannah and also Josh. And also, if you have questions, you want to email us directly at Public Information Office at dconc.gov. I want to give an opportunity to my teammates, Alicia and Randy. Do you have any other input for today's session?
I don't, but I did drop the survey for the lunch and learn in the chat. We'll appreciate if you will complete that just to give us feedback so we can start planning for next year's National County Government Month.
Thank you, Alicia. Well, if there aren't any other questions for us today, we just want to thank you again for your time and spent with us and the information shared. Savannah and Josh, thank you again for the information and excellent presentations provided today. Have a great day, everyone. And again, happy National County Government Month.